Hello, my name is Dr. Saundra Jain. I'm a clinician and an educator, and I'm absolutely passionate about the use of psychiatric scales in clinical practice. I'm so glad you've joined me today to talk about one of the gold standards in the world of bipolar disorder, and that is the Mood Disorder Questionnaire, or what we commonly refer to as the MDQ. Now, if you're already using scales and screeners in your practice, congratulations and keep up the good work. If you're new to psychiatric scales and screeners, I hope you'll find this video very informative. Let's take a look at the MDQ.
I believe it's worth repeating that in the world of bipolar disorder, the Mood Disorder Questionnaire, or what we commonly refer to as the MDQ, is considered a gold standard because so many clinicians and researchers are using the MDQ. It provides us with a common language in terms of screening for bipolar disorder. Now, if you're using another screener for bipolar disorder, no need to change, but you may want to give the MDQ a try and see what you think. The problems associated with misdiagnosis in the world of bipolar disorder, they're quite common and well known. In fact, to do our very best to avoid diagnostic errors, I'd suggest using the MDQ in combination with two other tools, the Bipolar Spectrum Diagnostic Scale, what we call the BSDS, and the Patient Health Questionnaire, the PHQ-9. This trio is an excellent combination of scales and screeners to help us gather really important clinical information in the diagnostic process. Let's now turn our attention to the MDQ. Here you see the MDQ, which is a brief 15-question screening tool that takes about 3 to 5 minutes to complete. It can be filled out either by the clinician or self-administered by the patient. Now, I prefer to ask the patient these questions, as patients may have questions for us about some of the items in question 1. The MDQ has good psychometric properties, as you can see. In a psychiatric patient setting, sensitivity is 73% and specificity is 90%. Within a community sample, you can see sensitivity is 28%, specificity is 97%. I have some great news. Scoring the MDQ is really quite easy. Let's see if you agree. For a positive screen, remember, this tool is not diagnostic. There are 3 questions. Let's take a closer look at each. The instructions are broken down into 3 sections. Now, I realize it's hard to read this clearly, so hopefully this will help. The stem of question 1 asks, has there ever been a period of time when you were not your usual self and? Then you'll notice there are 13 items the patient is asked to answer, either yes or no. For a positive screen, the patient must answer yes to 7 of the 13 items. Question 2. This question asks, if you checked yes to more than one of the above, have several of these ever happened during the same period of time? For a positive screen, the patient must answer this question yes. And then finally, question 3. How much of a problem did any of these cause you? Like being able to work, having family, money, or legal troubles, getting into arguments, or fights? For a positive screen, the patient must answer this question with either a moderate problem or a serious problem. As you can see, this is very straightforward. I'd suggest you try it a few times with someone you know well, just to practice. And you'll be more confident in using this tool in your clinical practice right away. After years of using the MDQ, I'd like to share a few practical tips about incorporating it into your clinical practice. Let's start at the top and work our way around. First, make sure you have plenty of copies readily available and sitting in full view. When the tool is stored in a file cabinet or it's sitting on a bookshelf, I've found that's right where they'll stay. If you have a practice website, you may want to provide the form as a PDF download or set it up so patients can fill it out online. You may want to provide blank forms to patients at the end of their session and ask them to complete it prior to the next appointment. I have several patients that do this. Another easy way to integrate this tool into your practice is to ask patients to fill it out in the waiting room prior to their appointment. The MDQ is a great way to engage patients in a conversation about bipolar disorder and provide them with useful information. Plus, this tool can serve to motivate patients to be more watchful of their symptoms now that they know what they're looking for. Let's touch on a few more things about the MDQ. Screening. As I mentioned before, this is a great screening instrument, but it's also a way to engage patients in a conversation about symptoms of bipolar disorder. The MDQ is an excellent way to improve communication with colleagues, especially those that are referring patients. Because if we're both familiar with the tool, we'll share the same language as we're communicating about our patients. And finally, the MDQ is a source of motivation. As patients begin to better understand this disorder, they often feel empowered rather than afraid, and I find they become more engaged in the treatment process. We all remember the old Nike ad campaign from years ago. Just do it. That slogan really does work here too. If you've never used an MDQ, I'd suggest you make this commitment. Print 10 copies of the MDQ and during the next week, use it with 10 patients. See what you think. Using the MDQ has changed the way I practice, and I believe it's improved the quality of care that I've provided. It's definitely served as a red flag, alerting me to the possibility of bipolar disorder in many patients. Now, if you don't have a copy of the MDQ, it's very easy to find with a simple Google search. I hope you'll check out my other YouTube videos on the PHQ-9 and the Bipolar Spectrum Diagnostic Scale. Because remember, by combining the PHQ-9 and the BSDS with the MDQ, this is a great trio of scales and screeners, and it creates a strong screening safety net for us in the world of bipolar disorder. So thanks for joining me today to explore the MDQ. I hope you'll give it a try.